Have you ever found yourself lying awake at night, caught in a moment of quiet reflection, wondering whether the habits you have carried with you throughout life are still serving you well as you grow older? For many men past the age of 50, there is one question that often lingers unspoken, hidden beneath layers of discomfort and social stigma. It is a question whispered in private thoughts, rarely voiced aloud. Is the practice of self-pleasure still healthy at this stage of life? Or could it be quietly causing harm to the body and mind? This is not merely a curiosity but a matter of profound importance, because as men age, their bodies undergo significant physiological changes, and what may have once been a casual act of youth now carries new implications. It is a subject clouded by myths, outdated beliefs, and a lack of reliable guidance, leaving many men in a state of confusion or even guilt. In truth, this concern is far more common than most would assume. Studies have revealed that the majority of men over 60 continue to engage in self-pleasure, though often in silence and secrecy, unsure of the consequences. There is a deep human need to understand whether this natural act supports vitality or undermines it. To explore this question fully, we must set aside cultural taboos and approach the subject with clarity, science, and compassion. When examined through the lens of modern research, self-pleasure in mature men emerges as neither inherently harmful nor inherently virtuous. Instead, it is a tool, one that can be used to maintain health and well-being when practiced mindfully, or conversely, one that can contribute to hidden risks when approached without awareness. The male body past 50 undergoes profound transitions. Testosterone levels begin to decline gradually, vascular health becomes more fragile, and the risk of conditions such as prostate enlargement, cardiovascular disease, and hormonal imbalances increases. These changes impact not only physical function but also psychological states such as mood, stress resilience, and sexual desire. Regular sexual activity, including self-pleasure, plays a significant role in maintaining balance during this phase of life. When a man achieves an erection, increased blood flow floods the corpora cavernosa, the spongy tissue within the penis responsible for firmness. This is not merely a fleeting moment of arousal but an essential form of physiological exercise, akin to stretching a muscle to preserve flexibility. Without regular stimulation, tissues can gradually lose elasticity, resulting in a decline in erectile function over time. Just as one would not neglect the health of their joints or muscles, so too should the sexual organs be considered in need of maintenance. One of the most compelling reasons to encourage moderate and conscious self-pleasure in later life relates to prostate health. Extensive research, including longitudinal studies conducted at leading institutions, has demonstrated that frequent ejaculation is linked to a reduced risk of prostate cancer. The mechanism behind this lies in the natural cleansing process that ejaculation provides, flushing out potentially harmful substances and stagnant secretions that may accumulate within the prostate ducts. For men who face an elevated risk due to age or family history, this simple, natural act can serve as a preventative measure with profound implications for long-term well-being. Beyond the physical structures of the reproductive system, self-pleasure engages the pelvic floor muscles, a group of muscles whose strength is crucial for erectile quality, ejaculatory control, and urinary health. With age, these muscles tend to weaken, leading to challenges such as incontinence or diminished sexual function. Each orgasm acts as a natural workout for these muscles, much like a series of carefully executed exercises at the gym. Maintaining pelvic strength is not only beneficial for sexual performance, but also for preserving dignity and independence in daily life. Particularly as urinary control becomes more challenging with age, the benefits extend beyond the purely physical. The human body is intricately wired to respond to sexual climax with profound neurochemical changes. Following orgasm, levels of cortisol, the body's primary stress hormone, drop significantly. Cortisol, when chronically elevated, contributes to a host of issues including hypertension, anxiety, and impaired cardiovascular health. In its place, a cascade of feel-good chemicals such as dopamine and oxytocin surge through the brain, creating sensations of relaxation, connection, and emotional well-being. This natural cycle offers a powerful, drug-free method of managing stress and boosting mood, an especially important consideration in later years when life transitions, loss, or social isolation may contribute to feelings of depression or anxiety. Another subtle yet invaluable advantage of regular self-pleasure lies in self-awareness. Through consistent engagement with one's own body, a man becomes attuned to subtle changes in anatomy and function. This heightened awareness can lead to the early detection of potentially serious conditions, such as testicular lumps, penile fibrosis, or unusual discomfort. Such early detection often makes the difference between a manageable condition and one that has progressed too far for simple intervention. In this sense, self-pleasure becomes not merely an act of gratification, but a form of self-examination and preventive care. Sleep is another domain profoundly affected by this practice. As men age, achieving deep, restorative sleep becomes increasingly difficult, with hormonal fluctuations and stress often conspiring to disrupt the body's natural rhythms. The hormonal shifts that occur after orgasm, particularly the rise in oxytocin and prolactin, coupled with the decline in cortisol, create a sedative effect that promotes sleep quality. This provides a natural, side effect-free alternative to sleep aids or medications, allowing the body to engage its own mechanisms for rest and recovery. Blood circulation in the pelvic region is another factor, often overlooked but vitally important. Over time, reduced circulation can lead to stagnation, inflammation, and discomfort, particularly in sedentary individuals. Self-pleasure stimulates blood flow, not only to the penis, but to the entire pelvic region, supporting the health of the bladder, prostate, and surrounding musculature. This enhanced circulation plays a role in reducing inflammation and maintaining overall pelvic vitality. For those who struggle with premature ejaculation or difficulty maintaining control, self-pleasure offers a safe and private environment in which to practice techniques that enhance sexual mastery. Methods such as the stop-start approach can be employed without the pressure of performance with a partner, gradually building confidence and control that translate into more satisfying partnered experiences. Furthermore, regular sexual stimulation keeps the neural pathways responsible for arousal and desire active. The brain is, after all, the most significant sexual organ. Without regular engagement, these pathways can weaken, leading to diminished libido and sexual responsiveness. Through consistent stimulation, even without a partner, a man can maintain a strong, active connection to his own sexuality. While the benefits are numerous and compelling, it would be irresponsible to ignore the potential pitfalls that accompany this practice when approached without mindfulness. One of the most common risks is social isolation, when self-pleasure becomes a replacement for genuine human intimacy, rather than a complement to it. The result can be a gradual withdrawal from relationships and social engagement. Over time, this isolation may contribute to loneliness, depression, and a diminished quality of life. To counter this, it is essential to maintain a balance, ensuring that self-pleasure exists within a broader context of connection and emotional intimacy with others. Physical risks also exist, particularly when technique is overly aggressive or lubrication is neglected. The skin of the penis is delicate and prone to microtears or irritation, which can lead to discomfort, infection, or scarring. This is easily avoided through gentleness and the use of water-based lubricants when necessary. Another concern is desensitization, which occurs when stimulation is always performed in the exact same way. This can create difficulty achieving arousal or orgasm with a partner, as the brain becomes conditioned to a very specific type of stimulus. The solution lies in variety, experimenting with different pressures, rhythms, and techniques to maintain flexibility and adaptability in sexual response. A more hidden risk arises when self-pleasure masks underlying health problems. If a man finds that he is able to achieve erections only during solitary activity, but struggles during partnered encounters, this may be a sign of cardiovascular issues, diabetes, or hormonal imbalances. Such patterns should not be ignored, but rather brought to the attention of a medical professional for proper evaluation. Posture during the act is another, often overlooked factor. Poor positioning, such as sitting hunched on a hard surface, can lead to nerve compression in the pelvic region, resulting in temporary numbness or even long-term pain. Choosing a comfortable, supportive position, ideally lying down, prevents such complications and ensures that the experience remains both safe and pleasurable. Emotional dependency represents yet another hazard. When self-pleasure becomes the primary or sole method of coping with stress or emotional challenges, it may evolve into a form of escapism that prevents the development of healthier coping mechanisms. Balance is key here, with activities such as physical exercise, meditation, and social interaction forming part of a well-rounded emotional toolkit. Cultural and religious beliefs can also play a role, instilling feelings of guilt or shame that cause psychological distress. It is important for men to recognize that such feelings, while deeply rooted, are not immutable. Speaking with a therapist who understands sexuality from a positive and health-focused perspective can help reframe the act as a natural and beneficial aspect of human life. Excessive frequency is another concern, as overindulgence can lead to pelvic congestion, manifesting as heaviness or discomfort in the testicles and surrounding areas. Moderation is crucial, with each individual listening carefully to their body's signals and adjusting accordingly. Additionally, for men concerned with fertility, frequent ejaculation may temporarily reduce sperm concentration and motility. Allowing 2 to 5 days of abstinence before attempting conception ensures optimal semen quality. Finally, the use of extreme visual stimuli, such as highly explicit or unrealistic pornography, can distort expectations and create a disconnect from real-world intimacy. When fantasy becomes divorced from reality, dissatisfaction and difficulty connecting with partners can follow. Balancing visual aids with imagination and genuine human experiences preserves healthy, grounded sexuality. In the end, self-pleasure for men over 50 is neither inherently virtuous nor inherently harmful. It is a tool, and like any tool, its value lies in how it is used. When practiced with awareness, moderation, and respect for one's body, it can be a powerful ally in maintaining sexual vitality, supporting prostate health, enhancing mood, improving sleep, and sustaining overall well-being. When approached mindlessly or excessively, it carries risks that can quietly erode physical, emotional, and relational health. The journey toward conscious practice begins with small, mindful adjustments, prioritizing comfort and posture, using lubrication when needed, varying technique, and maintaining a balance between solitary pleasure and partnered intimacy are simple yet transformative steps. By listening to the body's feedback and remaining attentive to changes, a man can navigate this deeply personal aspect of life with confidence and grace. As conversations around sexuality in later life become more open and informed, the stigma that has long surrounded this subject can finally begin to fade. Men deserve to approach their sexuality with knowledge rather than fear, with empowerment rather than shame. Age does not signal the end of vitality or pleasure. With conscious care, it becomes a time of deepened awareness, renewed confidence, and sustained freedom. By embracing this understanding, men can continue to live fully, honoring both the wisdom of experience and the natural rhythms of their bodies, well into their 60s, 70s, and beyond.